Cancer, a word that evokes fear and anxiety into the hearts of millions, it stands as the second leading cause of death worldwide. According to the latest 2024 cancer statistics, over 2 million new cancer cases are projected this year, adding to the staggering 20 million cases reported in 2023. Even more devastating, more than 600,000 Americans are expected to lose their lives to cancer in 2024. What's truly alarming is that nearly one-third of these deaths could be prevented with early detection and prompt treatment. Detecting cancer early is more than just a medical breakthrough. It's a life-saving opportunity. Studies show that diagnosing cancer in its initial stages can increase survival rates by an impressive 70 to 90%, based on the cancer type. Despite this, many individuals still miss the quiet, often unnoticed signals their bodies may be sending. In this video, we'll reveal 9 little-known early warning signs that cancer might be growing in your body. These are symptoms many dismiss as harmless, perhaps a mild cold, a fleeting ache, or a minor illness they assume will pass. Ignoring them, however, could mean ignoring a critical signal from your body. We'll explore the science behind these warning signs and highlight why early recognition is important. Understanding them could be life-saving, whether for you or someone you care about. Let's uncover these essential warning signs. 1. Fingernail marks. Changes in fingernails, such as unusual discoloration, thickening, or the emergence of dark streaks, can sometimes indicate early signs of cancer, specifically subungual melanoma, a rare but serious type of skin cancer that develops beneath the nail. This condition often begins subtly, with a vertical dark line, known as melanonychia striata, appearing unexpectedly and evolving over time. Unlike typical nail injuries, cancerous streaks are usually wider than 3 millimeters, feature uneven coloration, or have blurred edges. Another significant warning sign is Hutchinson's sign, where pigmentation spreads beyond the nail to the surrounding skin. Unfortunately, these changes are often mistaken for bruising or fungal infections, leading to delayed diagnosis and treatment. 2. Persistent hoarseness or voice changes. Unexplained hoarseness or voice changes lasting more than 2 weeks may be an early indicator of certain cancers, particularly those affecting the throat, larynx, or lungs. Tumors in these regions can exert pressure on or damage the vocal cords, leading to a raspy, weak, or strained voice. From a scientific perspective, hoarseness typically arises due to inflammation or disruption of the vocal cords. In cancer cases, research reveals that laryngeal and lung cancers can affect the nerves and tissues responsible for sound production. For instance, the American Cancer Society emphasizes that persistent voice changes can signal laryngeal cancer, as tumors may impede vocal cord movement or airflow. 3. Frequent mouth sores. Frequent mouth sores that don't heal within 2 weeks or keep reoccurring can be an early warning sign of oral cancer. Cancer cells interfere with the body's normal healing process, which is why these sores persist. Additionally, such sores may indicate a weakened immune system, possibly linked to cancer elsewhere in the body. Research shows that chronic irritation, caused by habits like smoking or heavy alcohol consumption, can trigger mutations in mouth tissues, leading to abnormal cell growth. According to the American Cancer Society, persistent sores, along with symptoms like lumps or white patches in the mouth, should never be ignored. Early detection is key to effective treatment, so don't delay seeking medical advice if you notice these signs. 4. Long-lasting bloating. Persistent bloating can be more than a minor digestive issue. It's sometimes an early sign of cancers such as ovarian, colon, or stomach cancer. While occasional bloating is usually harmless and caused by diet or overeating, long-lasting bloating that doesn't improve with lifestyle changes could signal something more serious. Here's why. Cancers in the abdominal area may lead to inflammation, fluid accumulation, called ascites, or blockages in the digestive tract, all of which disrupt normal digestion and cause chronic bloating. For instance, ovarian cancer can release proteins and hormones that trigger fluid retention. A 2015 study revealed that many women with ovarian cancer reported persistent bloating as one of their first noticeable symptoms. The challenge lies in recognizing the seriousness of this symptom since bloating is so common. However, if it's accompanied by other signs like sudden weight loss, changes in bowel habits, or a feeling of fullness after eating small amounts, it's crucial to consult a doctor without delay. 5. Persistent heartburn. Heartburn is commonly linked to acid reflux or indigestion, but when it becomes persistent, it may be a warning sign of a more serious condition, such as cancer. Specifically, ongoing heartburn that doesn't improve with over-the-counter medications or lifestyle adjustments could indicate esophageal cancer. Here's why this happens. Chronic acid reflux, also known as gastroesophageal reflux disease, causes stomach acids to repeatedly flow back into the esophagus. Over time, this constant exposure to stomach acid can damage the esophageal lining, leading to a condition called Barrett's esophagus. In this condition, normal esophageal tissue is replaced with abnormal cells that have a higher potential to turn cancerous. Research reveals that individuals with long-term gastroesophageal reflux disease face an elevated risk of esophageal cancer, with some studies indicating a nearly 20-fold increase in risk. While heartburn alone isn't a clear indicator of cancer, persistent or severe symptoms, especially when followed with other warning signs like difficulty swallowing, unexplained weight loss, or a chronic cough, should not be ignored. 6. Persistent flu-like symptoms. Flu-like symptoms such as fever, fatigue, and body aches are typically associated with infections, but when they persist without improvement, they may signal an underlying condition like cancer. Certain cancers, including leukemia, lymphoma, and others that impact the immune system, can manifest through these prolonged symptoms. Cancer cells can release substances that trigger inflammation or mimic an immune response, causing persistent fever or chronic fatigue. Research highlights that blood cancers, such as leukemia and lymphoma, often present with unexplained tiredness or low-grade fevers before more noticeable symptoms develop. For example, findings from the American Cancer Society reveal that these prolonged flu-like symptoms are frequently an early sign of such cancers. Imagine your body constantly behaving as if it's fighting off an infection, even when no illness is present. If flu-like symptoms persist longer than expected or fail to improve with rest, it's crucial to consult a doctor for further evaluation. Early detection of cancer can greatly enhance treatment outcomes. 7. The enigma of persistent pain. Pain serves as your body's natural alarm system, alerting you when something is wrong. Whether it's the sharp jolt of a broken bone or the dull ache in your back after lifting something heavy, pain has a clear message: pay attention and take action. However, not all pain comes with a clear explanation. Sometimes, it lingers without an apparent cause. You might not recall any recent strain or injury, yet there's that unrelenting discomfort that just won't go away. When pain persists without a known reason, it's essential to consult a doctor, as it could be a warning sign of something more serious, like cancer. This is because, as cancer grows, tumors may press against nearby bones, nerves, or organs. This pressure often causes a deep, unrelenting ache that disrupts daily life. And certain cancer cells release chemicals that irritate surrounding tissues, amplifying pain and sensitivity in the affected area. Or, when cancer spreads to other parts of the body, it can lead to new areas of pain, making it even harder to manage and identify the root cause. Chronic, mysterious pain should never be ignored. Seeking medical attention can be crucial for understanding its source and addressing any potential underlying conditions. 8. Persistent itching. Have you ever dealt with persistent itching that refuses to subside, even after applying lotion or taking antihistamines? While itching is often dismissed as a minor skin irritation, it can sometimes serve as an early warning sign of cancer, especially when it's unexplained and long-lasting. In certain cancers, such as lymphoma or leukemia, the immune system is compromised, leading to chronic itching, medically known as pruritus. This occurs when the body releases chemicals like histamines, which trigger intense itching. Similarly, cancers affecting the liver, pancreas, or bile ducts can interfere with bile flow, causing a buildup of substances in the bloodstream that result in widespread itching. Research, including insights from the American Cancer Society, highlights that unexplained severe itching, especially when no other cause is evident, may indicate an underlying condition like cancer. This is your body's way of signaling that something might be amiss. If itching persists for several weeks and lacks a clear explanation, it's crucial to consult a healthcare professional for a thorough evaluation. 9. Changes in bowel habits. Persistent changes in bowel movements, such as ongoing diarrhea, constipation, or noticeable alterations in stool size or shape, may signal an underlying issue, including the possibility of colorectal cancer. This is because cancer can disrupt the digestive system in various ways. Tumors in or around the colon can partially or fully block the intestines, causing irregular bowel patterns. For instance, stool may become unusually thin or inconsistent, indicating that the normal flow of digestion is being obstructed. Additionally, cancer can interfere with how the body absorbs nutrients or impact the way the intestines function, either slowing down or speeding up digestion. Research highlights that persistent bowel habit changes, such as alternating between diarrhea and constipation, unexplained long-term bloating, or other irregularities, may be linked to colon or rectal cancer. These symptoms are often subtle but persistent, lasting several weeks without an obvious cause. Remember, early detection greatly improves treatment outcomes. Although these signs and symptoms may not always indicate cancer, it's essential to take them seriously and consult a doctor for proper evaluation. If you found this video helpful, give it a thumbs up. Don't forget to subscribe to our channel. Thanks for watching.